The MDI plastic mouthpiece should be cleaned once weekly to keep the tiny nozzle opening fully clear. The goal is to maintain a maximal spray and the optimal size during particle. Follow the instructions of the specific device manufacturer. One method is to clean the MDI with water. Using this method, remove metal canister from the plastic mouthpiece. Hold the top of the mouthpiece under a running faucet for 30 seconds. Turn and let the water run through the mouthpiece. Allow the plastic container to air dry overnight. Do not dry with a towel as this may leave lint. Replace the metal canister back into the plastic container. Be sure that the counter is visible through the window. Press the inhaler twice in the air away from your face. Return the mouthpiece cover. Be careful not to get the canister wet. This can damage the contents or jam the release of drug. Some inhalers recommend cleaning with use of a cotton swab. Check the product information to see if this is the correct cleaning method for that product. Remove the canister. Wipe the small opening with a cotton swab. Some suggest a damp swab, others a dry swab, some first a dry swab and then a damp one. Twist the swab in a circular motion to remove any drug residue. Wipe the inside of the mouthpiece with a clean cloth. Let the actuator dry overnight. Replace the cap over the mouthpiece after the actuator has dried. Many patients do not routinely clean their inhalers, so when counseling a patient, ask to see their inhaler. If you observe a white powder residue around the opening, this would be a good opportunity to remind the patient of the need for routine cleaning. Holding chambers with and without masks also require weekly cleaning. Follow the manufacturer's instructions carefully. For discussion, we will use the aero chamber as an example. Remove rubber end of holding chamber where MDI is inserted in the cap. If the holding chamber has a mask, that may also be removed. Add a small amount of mild dish soap to a sink of warm water. Soak all pieces for 15 minutes. Because this device is made with non-electrostatic material, rinse in clear water. Shake out excess water. Allow holding chamber to completely air dry in a vertical position. Do not dry with a towel. Replace rubber end of the holding chamber. Be sure to replace the end so that the canister sticks upright from the holding chamber. The aero chamber has an alignment feature to assist with this process. Some holding chambers, like the aero chamber, may be safe to wash in the top rack at the dishwasher. Be sure, though, to carefully follow the manufacturer's instruction to avoid warping and other damage to the holding chamber or mask. If the holding chamber does not have the non-electrostatic feature, allow it to drip dry after cleaning and do not rinse with water. Leaving the mild soap film will help decrease electrostatic buildup. Holding chambers should be protected from extreme cold or heat to prevent cracking or warping. There is no standard replacement frequency for holding chambers. Examine a patient's device periodically for wear. For example, check for cracks, missing mouth covers, or dried, torn rubber connectors. Once yearly is a reasonable frequency for replacement. If replacing a spacer, consider replacing with a non-electrostatic holding chamber. When not in use, MDI should be stored at room temperature in a dry place. Avoid extreme heat or cold because the contents of the canister are under pressure. If the canister temperature falls below 50 degrees Fahrenheit, allow the inhaler to come to room temperature before use. If the canister is cold, less drug may be released. To avoid running out of medication, inhalers should be promptly replaced. Most inhalers have a dose counter which decreases by 1 with each actuation. After priming, the MDI's dose counter starts with 60, 120, or 200 depending on the number of doses for brand of the inhaler. At the completion of each dose, the patient should examine the dose counter to monitor doses remaining. For control of drugs, refill the inhaler when 5 days remain. For quick relief medication, refill when 20 doses remain. This reserves adequate doses in case of an emergency. The MDI should be discarded when the dose counter reads 0. Shaking the inhaler at this point may indicate some contents remain. However, the remainder is mostly propellant and should be discarded. It is possible to continue to use empty inhalers. Because of this, it is very important to reinforce monitoring the dose counter to avoid running out or continuing to use an empty inhaler. The size of numbers on most dose counters is very small, so the counter may be difficult to read. On some counters, the numbers will turn red to alert patients that the number of doses is low. Inhalers should also be discarded after the date on the packaging. The Respimat device is very similar to a metered dose inhaler.